Hello everyone, I am Dr. Muhammad Samah. Today I am presenting to you the Federal Decree Law Number 4 on medical liability. Based on Article Number 3, all profession practitioners in the Emirate must perform their work duties with Number 1. Accuracy and honesty as required by the profession, in accordance with the established scientific and technical principles, and to provide patients with the due care. They may not exploit the patient needs for the purpose of achieving an unlawful benefit, whether it's personal or otherwise, nor may they practice discrimination among the patients. All practitioners shall comply with the applicable legalization of the Emirate. Article number 4 states that without prejudice to the obligations set out in the applicable legalization, a physician in particular must comply with the following. Number 1. To comply with the rules, regulations, and the procedures of practicing the profession, as per his or her degree and specialty. Record the patient's health condition and his/her personal and family medical history before diagnosis and treatment. Use the available diagnostic and treatment tools required for the case. Use the necessary medical tools and equipment while diagnosing and treating patients with full attention in accordance with the established scientific principles. Inform the patient of the available medication options. Prescribe the medicine and clearly define its quantity and usage in writing, including the name, signature, and date of the prescription, and advise the patient or his/her family, as the case may be, of the necessity to adhere to the method determined by the physician. Also, Article number 4 states that the physician has to inform the patient of the nature and degree of seriousness of his/her illness, unless the patient interest requires otherwise, or he/she not psychologically prepared to be informed. Any of the patient next of kin, relatives, or fellows shall be informed in the following two cases. If the patient is totally or partially incapacitated, if his/her medical condition is serious that he/she cannot be personally informed, and he/she has not defined a person to be informed on his/her behalf. Inform the patient or his family of the complications that may arise from diagnosis, medical treatment, or surgical intervention prior to starting the medication process, and observe and provide treatment for such complications where possible. Cooperate with other physicians who are engaged in the patient's treatment. Provide information on the patient's medical condition and the closure of treatment whenever requested to do so, and consult a specialist physician if the case so requires. Cooperate with other profession practitioners who are engaged in the medical condition of the patient. Inform about people suspected to be infected with any of the communicable diseases as per the procedure set out in the legalization regulating communicable disease control. Article number 5 states that the physician shall not do any of the following. Number 1. Administer treatment without obtaining the patient's consent except in cases requiring emergency medical intervention, where consent cannot be obtained for any reason, or if the patient is infected with a contagious disease that threatens public health and safety. However, as for examination, diagnosis, and administration of the first dose of the medication, consent of the incapacitated patient is considered, provided that the patient's relatives or fellows should be informed of such medication plan. The physician shall not also refrain from providing treatment for a patient in emergency cases, or discontinuing the provision of treatment in all cases, unless the patient has violated the physician's instructions. Physician shall not refrain from providing treatment for a patient or first aid for an injured unless the case does not fall within the physician's specialization, in which case he/she shall provide the patient with the first aid and transfer him or her to the specialist physician or the nearest medical facility if the patient wishes so. Use unauthorized or unlawful methods in dealing with the medical case of the patient. prescribe any treatment before administering clinical examination to the patient, and health authorities may develop a system to provide telehealth services as per the controls and conditions set out in the executive regulation of this decree law. Physician shall not do any of the following: disclose the patient's confidential information that the physician gets to know while or due to practicing the profession, whether such information is disclosed by the patient or otherwise obtained by the physician. This prohibition shall not apply in the following conditions: if the disclosure is upon the request or approval of the patient, if disclosure is in the interest of a husband or wife and is made for either of them personally, if disclosure is made in an attempt to prevent or report a crime, in which case disclosure shall be only made to the competent authorities, if the physician is assigned as an expert by an official investigative authority in the state, if he or she is summoned by either of them to act as a witness to an investigation or a criminal case, if the physician is assigned to perform an examination by an insurance company or by an employer within the scope of the assignment, if disclosure is made upon request of the health authority with the aim of protecting public health as per the conditions and controls set forth in the executive regulation of this decree law, if the purpose of disclosure is for the physician to defend himself/herself before an investigation authority. Article number 6 defines a medical error. So a medical error is the error made by a practitioner due to any of the following reasons. Number 1 is ignorance of technical matters that are supposed to be known by any professional practitioner of the same degree and specialty. Number 2, non-compliance with the recognized professional and medical principles. Number 3, non-exercising due diligence. Number 4, negligence and not paying attention. Article 17 defines when the medical liability shall not be established. First thing is if the harm is not caused by any of the reasons set out in Article number 6, if the harm is caused by the patient's own actions or due to his/her refusal to receive treatment or to follow the medical instructions issued by his/her physicians, or if the harm is caused by some external reason. If the physician applies a certain medical method of treatment in contradiction to other physicians of the same specialization, as long as such method conforms to the generally acceptable medical principles, in case the recognized or unexpected medical effects and complications resulting from the medical practice are not caused by medical error.